Continuation of our talk on oral and oropharyngeal cancer. We mentioned smoking and drinking need to be avoided to prevent a big number of such cancer. The patients, once they recognize any lesion in their mouth or in the back of their mouth, oral or oropharyngeal area, they need to contact their doctor, family doctor, who will examine the area and refer them to a specialist. In addition to physical lesion in the mouth, pain, bleeding, sometimes the pain is referred to areas like the ear and so on. Once cancer is recognized and diagnosed, patient will have options of treatment. For early cancer, the options are either surgical excision of the lesion seen in the mouth, and depending on the size of the lesion, if the lesion more than 2 cm, the lymph nodes are looked at as well. By excision, we call it neck dissection, and there are various levels of neck dissection. This is diagnostic procedure to see whether the lymph nodes has cancer or not. Once patient staging is completed, then options of patient's treatment is either surgery or radiation. Surgery is an excellent option, but if in an area could compromise function, i.e. tongue, radiation might be an alternative treatment. There is no generic way of deciding whether this patient go for such treatment. It has to be individualized. Some patients prefer to have surgery, that's good. Some patients want to keep the function of their organ and want to explore other options. Then those patients have that right. And in cancer treatment today is multimodality. Either surgery or radiation or chemotherapy or combination of the above. Is important for the patient to hear pros and cons of each option and decide what best treatment suit him. A multimodality cancer treatment where the surgeon, the radiation oncologist, the chemotherapy doctor meet together and decide the optimum treatment for such patient. It is a team work, and specifically now I'll be talking on tongue cancer, where we divide tongue into anterior 2/3 and posterior 1/3. Today's if the cancer is early, where the cancer in the tongue is mobile. In advanced cancer, the tongue is fixed because the cancer spread and fixed the tongue to the underlying tissue and the deep muscle. For early cancer, excision is an option. Usually the surgeon remove the tumor with a margin, and it depends on the size. It depends on the size of the tumor. For larger tumor will be big defect in the tongue. For smaller tumor will be small defect on the tongue. An alternative to such option is a radiation treatment. Basically, a radiation, if the tumor is less than 2 cm, we call it monotherapy, meaning the radiation either by implant, putting tubes into the tumor in the tongue under anesthesia, so the patient doesn't feel anything, no pain. Radioactive source travel and clean the cancer. Tubes are taken out, and end of discussion. That could be given over 2 to 3 days while the patient in the hospital. But patient is awake and does not have pain. This we call it brachytherapy. Brachy means near treatment, highly effective in controlling such lesion. For larger lesion, in addition to doing brachytherapy, we need to clean the node and the other tissue. So patient get 5 weeks of radiation treatment from outside, and treatment to the tongue by brachytherapy, and this result in controlling disease without removing any part of the tongue. And the main advantage of this treatment is preservation of the function of the tongue without compromise of cure. Base of the this applies to the anterior 2/3 of the tongue. We call it oral tongue. Posterior third of the tongue, we call it base of the tongue. Those are more sensitive to radiation than oral tongue, and the treatment usually radiation with excellent cosmetic results. Some surgeons like to be aggressive enough to treat those lesions, but the side effects might be higher, especially swallowing and so on. So radiation is preferred treatment because not only it keeps the function of the tongue, but also prevent problems like inability to swallow and so on. On top of that, it's highly curable, extremely high curable chance without compromise of cure. And as I mentioned earlier in this session, that today's technology, we preserve the salivary function, so patient saliva should not be compromised except for those cases where the cancer is advanced and close to tumor. There would be some compromise of salivary function, but for earlier lesion, especially if the cancer away from salivary glands, the salivary glands is saved, spared by delivering radiation to the tumor and other areas at risk, avoiding salivary gland, that will achieve excellent function of the salivary gland preservation, result in no dryness of mouth. Radiation treatment is not known to many people. Some people think that this treatment causes problems and no cure. That's not the case. Radiation nowadays used very much precisely, excellent chance of cure, minimum complication, and most important, preservation of the function of the organ without any compromise of cure. Tongue cancer, important for those who cured and treated from tongue cancer, not to continue, need to stop smoking and drinking, and keep good oral hygiene, and keep good nutrition, and be checked regularly to look for a second cancer somewhere in the upper aerodigestive tract and the lung. So they need to have a radiological follow-up in the lung and in the oropharyngeal area and the upper aerodigestive area by physical examination and radiological examination if needed. In summary, stop smoking and drinking, an important component in preventing cancer of the oral cavity, oropharynx, and now on our specific topic to the tongue. Early lesion need to be recognized, early symptoms of pain, bleeding. Need to see your doctor. Once you diagnosed of cancer, you need to have the options of either radiation or surgery, and you need to pick it.